Hi, welcome back to everyone. Today we will discuss about acute pyelonephritis, its causes, its clinical presentation, its treatment, its diagnostic evaluation and management plan. And I am your instructor, Dr. Muhammad Junaid Bajwa. Welcome to all of you. Let's start. Acute pyelonephritis refers to an infection involving the renal pelvis and kidney parenchyma. It's classified as an upper urinary tract infection and can occur in otherwise healthy individuals. That's the uncomplicated form. Are in patients with structural or functional abnormalities, which we call as complicated pyelonephritis. Acute pyelonephritis most commonly caused by Escherichia coli, accounting for nearly 90% of the community acquired cases. Other gram negative organisms such as Proteus and Klebsiella are also seen, particularly in complicated cases or hospital settings. The infection typically ascends from the bladder through the ureters into the renal pelvis. Conditions that impair urine flow, such as obstruction or reflux, facilitate bacterial entry. In rare cases, bacteria reach the kidney through the bloodstream. Patient often presents acutely ill with fever and chills. Flank pain or costovertebral angle tenderness is a hallmark feature. Lower urinary tract symptoms like dysuria or frequency may accompany it, reflecting cystitis. On examination, you will typically find a febrile patient with flank tenderness. In severe or septic cases, hypotension or tachycardia can be present, emphasizing the need for urgent intervention. Urine culture is the gold standard for diagnostic evaluation and diagnostic test. Imaging, especially CT scan, helps to identify obstruction or abscesses, especially if the patient doesn't respond to therapy within 48 to 72 hours. Since several renal and urinary conditions can present with flank pain and fever, it's important to rule out cystitis, abscess, glomerulonephritis, or stones through appropriate laboratory and imaging investigations. Initial management includes hydration and symptom relief. Empirical antibiotics should be started promptly, then refined according to culture results. Severe cases requires hospitalization for intravenous antibiotics and monitoring. Complications can be serious, including abscess formation or renal scarring. Diabetic patients are particularly prone to papillary necrosis. Prompt treatment is crucial to prevent these outcomes. Most patients recover fully with early antibiotic therapy, but delayed or inadequate treatment can lead to renal damage or systemic complications. Preventive measures centers on maintaining urinary flow, treating lower urinary tract infections promptly, and avoiding prolonged catheter use. So, to summarize, acute pyelonephritis is defined as bacterial infection of the renal chyma, most commonly caused by Escherichia coli, diagnosed via urine analysis and urine culture, and can be managed with antibiotics and supportive care. And early recognition can prevent the complications. So that's it from today's lecture. Hope to see you in upcoming lectures. Thank you very much for listening me very attentively. Good luck and take care and bye.